More and more young women these days are getting pregnant and are faced with three decisions. One, to have the baby and possibly live broke for the rest of your life. Two, to give the baby up for adoption. Three, to have the baby aborted. Today I will be discussing with you everything on abortion, the statistics in the U.S., the different procedures you can use, and last but not least, the consequences. First, the statistics. The abortion statistics of the United States. In 1995, reported legal abortions, there were 5,949 under the age of 15. There were 146,284 between the ages of 15 and 19. 245,653 between the ages of 20 and 24. 170,644 between ages of 25 and 29. 167,715 between the ages of 30 and 34. 61,052 between the ages of 35 and 39, and 18,498 from women the age of 40 and up. During the 1980s and 1990s, 1.5 million annually abortions were reported. Almost every third baby conceived is killed by abortion. From the 1988 Morbidity and Mortality Weekly Report Centers for Disease Control Centers, Atlanta, July 1991. Also, with the 1.5 million there, these are the statistics of how old the unborn child was. 1.2% or 18,000 were 22 weeks or older. 10% or 150,000 were 13 weeks to 20 weeks. And 88% or 88.8% or 1,332,000 were 12 weeks or younger. Abortion repeats in the United States. In 1973, there was a percentage of 20% repeat abortions. In 1987, the percentage raised to 44% and rose to 45% in 1997. 63 abortions were white, 33% were black, and 4% were other. There are many different ways to have an abortion. In the next section we'll discuss how long in pregnancy and how it is used. The French abortion pill, or RU486, is the first one we'll be discussing. During the 5th and 7th week only, it is done, and it kills the baby after the heart has begun beating. There are 4 visits, and in this first visit the woman needs to have thorough history, physical exam, and a blood count. If she is anemic, has high blood pressure, kidney disease, asthma, vaginal infection, smokes, or is over the age of 35, she is rejected. Also, during the first visit, she needs an ultrasound exam to confirm the age of the baby and rule out tubal pregnancy. Then she signs papers and waits a day or 2. On the second visit, she takes the pill which blocks proestrogen nutrients to the baby and basically starves the baby to death. On the third visit, she is given the pill prostaglandin, which makes her go into hard labor, and the baby passes within that day. The fourth visit consists of a checkup. Basically, if she has not stopped bleeding or she has hasn't aborted, the doctors will take an ultrasound to see if her uterus is empty. If not, she will have her womb scraped out. Dilation or curettage. This procedure is the most uncommon of today's world because of a lot of bleeding will occur. It is done within the first 10 weeks. Abortionists insert a loop-shaped steel knife into the uterus and cuts the baby and placenta into pieces. Then he or she takes that and scrapes it into a basin. Salt poisoning or saline injection. During the first 3 months of pregnancy, abortionists injects strong salt solution directly into the amniotic sac. The baby then breathes and swallows the poison, and it takes over an hour for the baby to die. In a day or two, the dead baby will be delivered. Suction. Done late in pregnancy, abortionist paralyzes the opening of the womb first, then he inserts a hollow plastic tube with a knife-like tip into the uterus. The tube is connected to a pump which tears the baby up and sucks it out in pieces. Since the baby's head is so big and cannot pass through the tube, another instrument compresses the head and takes it out. Finally, the placenta is cut out and sucked into a bottle. Hysterotomy is done very late into pregnancy. It is like a C-section where the abortionist cut open the patient through the abdomen and takes the baby out that way. Since it is late in pregnancy, the babies are still very much alive. Some abortionists have known to plunge the baby into buckets of water or smother it with the placenta afterwards. Others cut the cord while the baby is still inside, which cuts off the oxygen intake to the baby. Partial birth abortion, done between 20 weeks and 4.5 months. Some are even done full term. What this means is the mother will partially deliver a living baby vaginally before killing it and completing the delivery. Guided with ultrasound, the abortionist grabs the baby's legs with forceps. Baby's legs are pulled out into the birth canal and the entire body is delivered except for the head. The abortionist then jams a scissor into the baby's skull, opens them up to create a bigger hole, and then replaces them with suction catheters, which is used to suck out the brains. A quote from Dan Lundgren, Attorney General of California in 1996. It is a procedure where the child coming down the birth canal is actually turned by the doctor so the child is no longer coming down head first, but rather feet first. The reason is if the doctor did what he or she did with the child's head exposed, it would be murder in every single one of the jurisdictions in the United States. There are a lot of consequences from getting an abortion. The last section will discuss that the side effects of all procedures include bleeding, pain, tubal pregnancies in the future, incomplete abortions, uterine rupture, which is just with the RU486 if it's done at 18 weeks or later, psychological upset, post-abortion syndrome, and a few cases of death. Some physical consequences are tremendous increase in STD levels and promiscuity. It is the 5th leading cause of maternal death in the United States. It can also increase risk of breast, cervical, ovarian, and liver cancer. Cervical lacerations and placenta damage can cause future problems in pregnancies, such as miscarriages, premature births, fetal deaths, tubal pregnancies, and handicapped babies. 30% of the women get infections or pelvic inflammatory disease. 127% of premature births, and the percentage is higher with multiple abortions. 2% of women have suffered bleeding, fever, and infection that was life-threatening. Some psychological consequences are women have less respect for life, denial, relief followed by guilt, and sadness of the death of the baby. There are over 100 reactions to abortion, such as smoking, alcoholism, drug abuse, eating disorders, sexual addictions, and self-destructive acts. Post-abortion syndrome. 19 to 60% of women suffer mild depression to either suicide or attempted suicide. Feeling of guilt and regret in other pregnancies. They can also have flashbacks and nightmares, not be able to trust anyone anymore, and in some cases, divorce, domestic violence, and child abuse. A quote from Men and Abortion by Wayne Browning, leader of Men's Abortion Recovery Ministries. Fathers experience the same negative post-abortion reactions that women do: anger, depression, guilt, and broken relationships. For our conclusion, we've discussed everything about abortion that I could find, from statistics to different ways and then to consequences. All I have to say about this is, and the information that I've learned, is that I can never have an abortion. Thank you.